12:30, the buzz of Cincinnati. Let's go to my good friend over at the Urology Group, Dr. Kappa. Dr. Kappa, how you doing today?
Oh, I'm doing great, Lincoln. It's great to be on your show again. Really looking forward to our conversation. It's always a pleasure. I'm actually calling in from the great state of Oregon. I'm out here on the West Coast visiting my wife's family. She grew up here. I had a triathlon race this weekend, so a little sore, a little tired, but really got a second wind here, ready to talk really about anything that comes to men's health, sexual health, kidney stones, whatever you want to discuss. I'm looking forward to it.
Let's hit on those kidney stones first. You got some kind of new treatment that can get rid of kidney stones forever.
A little bit. Well, that's a little bit of an exaggeration. But yeah, no. What I would say is first that kidney stones are really one of the most painful conditions that a person can experience. 1 in 10, up to 1 in 10 people can get a kidney stone in their life. But the good news is we're getting new technologies. We're faster, we're safer, we're more effective in treatments, and we also really focus on prevention. So just the note for your listeners, hopefully you can hear this at the beginning and end of the conversation. Drink water. It's important to stay, especially during this hot summer weather, to stay hydrated. But yeah, we do have a new technology. It's called CVAC to help us treat kidney stones, and I'm happy to go into detail with you about it.
Now, I never had a kidney stone, but everybody that's had one, they say the pain is just unbearable when you pass a kidney stone.
Absolutely. Well, it's some of the worst pain of your life. Women who have had babies will say it's worse than childbirth. Now, guys can't say that, obviously, but we're, it's one of those things. We meet patients at, one of the low points of their life where they're suffering. They were in the emergency department, and they come to us for treatment, and our job is to get that kidney stone out and get them back to their normal life. But yeah, it'll really literally stop you in your tracks and put you in the hospital.
Gee. And so what is this treatment that gets rid of them? What is that treatment?
Yeah, so there's multiple ways to do it. We use lasers, we use sound waves. The newer technology that we've got a lot of experience here at the Urology Group with in the last couple of years is called CVAC. And the way I would describe this is, going directly to the stone with a small scope where you can visualize it, where you can irrigate water and aspirate in and out, treat the stone with a laser and remove the stone fragments all at the same time. Traditionally, and when I first started my career, we'd have to individually basket out stones. It took a long time, but this new technology, again, it's called CVAC, has really allowed us to treat bigger stones and treat them more effectively and efficiently and get patients, again, back to their life faster than we did before. So, yeah, we're really excited to offer this and have a really good experience with this new technology. And, again, the whole purpose of these treatments is to get patients back to their normal life, past this painful kidney stone episode and, go on living life.
And what causes a kidney stone?
Great thing. So I mentioned at the beginning, dehydration.
That's the only thing. The only thing. Dehydration that causes them.
Well, there are more factors. There are dietary factors. Certain foods that if you do just an extreme amount can cause problems. But I tell patients, as long as you're doing everything in moderation with a good, healthy diet, it's more about water intake. So the best way to prevent stones is water. So staying hydrated. And, one way to kind of tell that is if your urine is dark yellow, concentrated, you're dehydrated. So drink more water. That's really the bottom line.
All right. Let's talk about some other things. Like I say, these TV and radio is bombarded with these commercials. Low T, this and that. If you're not sleeping well at night, low T. If you're not doing the thing in the bedroom, low T. If you're not exercising, it's hard to exercise, low T. They're blaming everything on low T when it comes to men.
Yeah, that's true. I mean, we are bombarded. This topic, and it's one that guys don't like to talk about, but I just want to kind of talk about how common, not just low T, but erectile dysfunction is. So ED, 40% of men by the age of 40 will experience erectile dysfunction, 60% by the age of 60, and 80% by the age of 80. So the way I like to frame this.
Wait, did you say 80% by the age of 80?
80% of men by the age of 80 will experience erectile dysfunction. Yes, sir. So
that don't give me a whole lot to look forward to. I tell you, I'm 75 now. That doesn't give me a whole bright outlook to look forward to.
Well, here's what I would say. You can look forward to, Lincoln, is we have really effective treatments. You started on testosterone. That's part part of it. But one the term I just want to throw out there, and I got this idea from Dr. Mohit Kara. He's down in Texas at Baylor, really a leader in sexual health and testosterone therapy, and he coined the term sex span. And what that basically means is how long. And I'm going to focus on men's sexual health here. Obviously, women's sexual health are very important too, not my area of expertise. But how long do you have the desire and the ability to have sex? That's your sex span. And you would ideally want that to last your whole life.
Yes.
And so that's one of the things that we focus on are, what can we do proactively, not just in treatment after you develop erectile dysfunction or testosterone issues, but what can you do to prevent these problems? And so I really think of this in terms of maximizing a man's sex span, how long he can have the desire and the ability to have sex. That's important to most men, obviously.
Yeah, and like you say, so now they got all this stuff going on there. They got the pills, they got the injections, they got everything out there for men to keep it going, I guess, huh?
Oh, absolutely. Yeah, I mean, and what you're describing, for sure, we can talk about some of those, and I want to really destigmatize these treatments. They're very common. Men are nervous about doing these, even just taking a pill, but they're very effective. But before that, actually, I want to step back a little bit, because I think this is to your 40-year-old guy out there listening, your 50-year-old guy who may not have problems now. You mentioned, hey, I got some dark days in my future. Not necessarily. Here's the basics, okay? I tell patients, I've really shifted my focus a lot with patients is master the health basics. Regular exercise, especially strength training, prioritizing sleep, aiming for 7 to 8 hours a night, eating a good, healthy diet, your fruits and vegetables, reducing stress. That has a big factor on this, and avoiding harmful habits, smoking, drug use, excessive alcohol. And then really understanding and being proactive about your health, diabetes, hypertension, cardiovascular disease, all these things contribute to erectile dysfunction, testosterone issues. So those I always kind of start the conversation there before we get to the pills and the shots. Those are important, but start with the health basics. They can really improve your overall health and your sexual health.
Now, anybody can take a pill, but when you talk about these injections, it hurts me just to think about doing that. What is that?
Yeah, well, for sure. So you're talking about injections into the penis. One common version of this is called Trimix, and that's it is an advanced therapy. A lot of times we have men who've suffered from prostate cancer, but they've survived it. They've gone through treatment. They've gone through radiation or surgery, and they're survivors. We celebrate that. They survived prostate cancer. It's the most common cancer in men. But one of the side effects of all this is erectile dysfunction. And sometimes for those guys and for other guys with severe diabetes or hypertension, the pills, like your Viagra, Cialis, things you hear about on the radio and these ads, they don't always work. And so we can offer men, and it's really not painful, an injection that's done before sexual activity, 5 to 10 minutes. We do that in our office. We do it in a very safe way. We start with a very low dose. And 100% of guys are afraid of this. When I mention it, your listeners are probably
it hurts
cringing.
for you to say it. It hurts.
Do not talk about that on the radio. do not do that to me. And I just really want to destigmatize it. What's worse than a very tiny needle with a essentially painless shot to improve your sexual health is ignoring your sexual health and suffering with erectile dysfunction, and that which can lead to depression and a few other symptoms that no one wants to experience. So I tell guys, be proactive about your health. At least come in to the urology group or to your primary care physician. Talk to your doctor about this, because we have a lot of things beyond the pills, beyond the shots, that can help you with your sexual health.
Unbelievable. All right. Dr. Kappa, is always great talking to you. You have all kind of information here, and we love talking to you. They can check you out over at the Urology Group, right?
Yes, sir. Lincoln, it was a pleasure being on. Looking forward to, doing this again soon. We'll pick another topic and love to have these conversations with your listeners.
All right. We'll talk to you later. Dr. Kappa from the Urology Group. Thanks for stopping in and checking us out. Appreciate it.
No problem. Take care, Lincoln. Bye.